Medicare has finally announced the 2026 Medicare cost increases for premiums, deductibles, copays, and IRMAA amounts for the different parts of Medicare. And I can't say that it's the best news for those of you on Medicare, but let's go over how much you're going to need to pay for Medicare in 2026. I have busted out the trusty whiteboard to help us with this conversation. We're going to go in alphabetical order with Medicare Parts A, B, C, and D. Parts B, C, and D costs apply to more people than A, so there are chapters along the bottom here if you'd like to skip, or you can learn about the Part A costs you would need to watch out for if you don't have something like a supplement plan, an advantage plan, or other secondary coverage like TRICARE, FEHB, or others. Now, Parts A and B make up what is referred to as Original Medicare or Traditional Medicare. These are administered by the federal government. Part A is your hospital coverage, meaning if you are admitted into a hospital, it is like your rent to stay in the hospital. So Part A covers that and a few other things like skilled nursing, some home health care, and hospice care. So let's start with the Part A premiums, or the monthly costs that you have to pay just to have this coverage. Now, the good news is that 99% of Americans pay $0 in premiums because you or your spouse have worked at least 40 quarters, which is 10 years, and you've contributed to the Medicare system through your taxes. This hasn't changed for 2026. For the 1% that do have to pay Part A premiums, which would be those who do not have enough work credits either by yourself or through your spouse, you do have a monthly premium, and it is based on the number of work credits that you have accumulated. For those of you who only have between 30 and 39 quarters, the monthly premium is $311 per person per month. That is up $26 from the $285 that it was in 2025, or up about 9%. If you have worked fewer than 30 quarters, that premium is now $565 per person per month, a $47 per month increase over 2025 costs. Remember, you can still qualify for premium-free Part A through your spouse's work record. So if your spouse does have the credits and you don't, you can still get premium-free Part A as long as your spouse is 62 years old or older. I have people who comment in my videos about how they have contributed to the Medicare system their whole lives in taxes, so Medicare should be free. Well, your Medicare tax contributions that you've made your entire life just go to covering Part A. Nothing else that we're going to talk about in this video. And for those of you who are not contributing to Medicare because you did not work, it means that we now have two people getting premium-free Part A on one person's work record. This is in no way, shape, or form saying that that isn't right. It's just the realities of the strain on the financials of the Medicare system as you hear these messages. All of those contributions made through the Medicare payroll taxes don't even cover all of the Part A costs nationally. So that's some clarification around why all of Medicare is not free. Now let's move on to other Part A costs. Part A has a unique deductible and some copays to be aware of. The dollar amounts for both have changed for 2026. The Part A deductible is the dollar amount that you need to pay first before Part A starts to cover anything. This mostly comes into play for those of you who have traditional Medicare only and you do not have something like a supplement plan, TRICARE, FEHB, or an Advantage plan. The Part A deductible is not an annual deductible like many of you may be used to with other insurance plans. It is a per benefit period deductible, which means that you could see multiple Part A deductibles in a given year. The Part A deductible amount for 2026 increased to $1,736. That is an increase of $60 over 2025. This deductible amount covers your first 60 days in the hospital. If you stay longer than 60 days, you will have additional daily copays. So for days 61 through 90 in 2026, the copay is now $434 per day. That is up $15 per day over the previous year. For days 91 through 150, which are referred to as your lifetime reserve days, the copay is $868 per day, which is up $30 per day over last year. The final changes to your Part A costs in 2026 revolve around the copays for skilled nursing facilities, as these are a Part A expense. After you pay your Part A deductible, the first 20 days in a skilled nursing facility are covered at 100%. That hasn't changed. For days 21 through 100, you have daily copays, which are now $217 per day. This is up $7.50 over last year. For all of the days over 100, so 101 plus, you are still responsible for 100% of those costs as they are no longer covered by Medicare Part A. Now, these all increased, which is expected. Nobody likes increases, but for Part A, we're looking at about a 9% increase on those premiums, and then about a 3.5% increase on each of the other costs. And frankly, that's not that bad. Now, why do I say this? Because it is close to the 2026 cost of living adjustment increase on Social Security benefits. You'll see what I mean by that here in a minute. Now, if you are new to the Medicare conversation and these costs just made you feel a whole lot worse about your future life on Medicare, the good news is that most people choose to cover these gaps with either a Medicare supplement plan or a Medicare Advantage plan, or they have access to other coverages like I've mentioned, TRICARE for Life, and others. And all of these do a great job covering most of these Part A gaps, but they accomplish this in very different ways. I have a lot of videos about these plans on the channel, so make sure you go watch those if you would like to get more understanding around Part A and how those costs are covered. Let's move to Medicare Part B. This is your medical coverage. Think doctor visits, labs, x-rays, chemotherapy, and a bunch of other things. This is more applicable to everyone because everyone on Medicare deals with Part B costs in one way or another. Your 2026 base Medicare Part B premium is now $202.90 per person per month. This is an increase of $17.90 per month, or another $214.80 a year that you need to come up with. That is a 9.7% increase over the 2025 Part B premiums. This is why I wait to make this video until the changes are all finalized. All of the projections that have been out there around these costs had different numbers here, so please be careful when relying on projections and not official numbers. Now, contextually, the Social Security cost of living adjustment is that additional amount they give Social Security beneficiaries each year. It helps counter some of the rising costs in the form of this cost of living adjustment. And it is an increase in the dollars to your Social Security, which is a 2.8% increase for 2026, meaning your Social Security income went up 2.8%, while your Medicare Part B premiums are up 9.7%. To calculate your cost of living adjustment for Social Security increases, they use something called the CPIW. This is a combination of a basket of goods that they look at and how those prices have changed over the last year. This does not include things like your Medicare health costs. This means that your healthcare fixed expenses as a percentage just went up at a higher rate than your fixed income amount. This is why I said Part A isn't so bad, but even that is a 3.5% increase in healthcare costs versus a 2.8% increase in Social Security income. And then Part B tends to outpace Social Security COLA increases by an even larger factor, in this case, by more than 3 times as much when strictly looking at percentages. Now, your Social Security check is a bigger overall number, so 2.8% of a number in the thousands is a larger dollar amount than 9.7% of the $185 2025 premiums, but the average Social Security beneficiary will see about a $50 increase per month in their Social Security payments, while also getting a $17.90 increase to their expenses through just their Medicare Part B premiums. However, Medicare Part B isn't the only thing going up in your general life's expenses, and it's not even the only thing specific to Medicare going up. Supplement plan increases are up by an average of about 14% this year. Advantage plans saw an increase to maximum out-of-pocket costs by about an average of $900 a year. And then we still have some more costs to get to in this video. Now remember, your Part B premiums are based on your income from 2 years ago. So if you are a high income earner, or maybe you had a big year 2 years ago because you sold a property or you sold some investments, your Part B premium will be higher by an amount called the Medicare Income Related Monthly Adjustment Amount, or IRMAA. Here is an updated chart for 2026, which you can download at theretirementnerds.com. I have a link in the description of this video. These increased premium amounts affect roughly 8% of the people with Medicare Part B. Something to note is that most of the income brackets increased over last year by between 2.4 and 3%, meaning instead of $106,000 and under for the base premium last year if you file single, you would have to have a modified adjusted gross income over $109,000 to affect this year's premium. Again, this is your income from 2 years ago, or $218,000 as a couple, and these dollar bumps carry through each of the other bracket levels as well. Notice the important differences here. Your premiums all went up by 9.7% at all of the levels, but the windows where you are bumped into higher premiums only went up by 2.4 to 3% instead of that same 9.7% buffer. This means more people could be falling within these IRMAA thresholds in comparison to the percent increase of the premium amounts. Okay, along with the Part B premium increase, we will also see an increase to the Part B deductible. Remember, deductibles are the dollar amounts that you need to pay first before Part B starts to help. If you are on any Medicare supplement plan that is not Plan F or Plan J, you pay this deductible before your supplement plan starts to kick in. For 2026, the Part B deductible will be $283. That is up $26 or about 10% over 2025. Unlike the Part A deductible, this is an annual deductible. Once you meet it, you are done for the rest of the year and it will reset in January. Okay, now we're going to move away from traditional Medicare and over to the other letters. Part C and Part D are not administered by the federal government. They are heavily regulated by the federal government, but they are not functionally carried out by the government. They are run by private insurance companies. Part C refers to Medicare Advantage plans. Latest numbers that I have access to have 76% of everyone on an Advantage plan paying $0 in premiums. Of those that have premiums, Advantage plan premiums nationally saw an average decrease of 4%. However, this is highly state-specific, with Wyoming seeing an average increase of 120% in plan premium costs, and then a state like Arkansas seeing an average decrease of 68% to plan premiums, and then we have everything in between with different states. The last thing on Part C Medicare Advantage plans would be the maximum out-of-pocket numbers. For 2025, the average max out-of-pocket was almost $5,000 exactly. For 2026, it's going up by about $900 to $5,900. That's about an 18% increase. Again, this is an average with plans much lower than this in many areas, as well as plans much higher than this in other areas. Now, the federal government does regulate the highest max out-of-pocket that an Advantage plan is allowed to have. In 2025, for in-network services, the highest max out-of-pocket allowed was $9,350. 2026, that actually goes down to $9,250, about a 1% decrease. PPO plans have a separate combined in and out-of-network max out-of-pocket. The 2025 highest allowed was $14,000. 2026, that goes down to $13,900. Going back to just the in-network max out-of-pocket, very few plans have that high of a max out-of-pocket as evidenced by the $5,900 average. But there are plans that do. This is just the absolute federally regulated maximum out-of-pocket that an Advantage plan is allowed to have. Okay, let's move to your Part D or your prescription drug costs. These are also administered by private insurance companies, and this was an absolute mess in 2025. It's kind of continuing into 2026. Let's start with the premiums. In 2025, the Centers for Medicare and Medicaid Services had the average Part D premium at about $38. That's all plan costs and taking an average. In 2026, the CMS number for the average is $34.50. We don't have something like an enrollment-weighted average yet because we are in the middle of the annual enrollment period. To give context, the 2025 enrollment-weighted average was $55, so higher than the CMS average number. I don't really know what to tell you here. There is what they are using for the average costs and saying that Part D premiums are on average going down. And then there's what you and I are seeing and hearing from people from all over the country and what they are experiencing with some pretty significant increases on their Part D plans. There are still $0 plans available, but there are also, I've seen as high as $172 a month. If you do have higher cost medications and are not looking at these super low cost plans, people are seeing significant increases to their Part D drug plan premiums. So it's hard for me to tell all of you experiencing this, hey, CMS says it's good news. Part D plans are going down. But according to CMS, 2026 Part D plan premiums are going down on average. Now remember, your Part D premiums can also be adjusted by your income from 2 years back. Like the Part B IRMAA amounts, you also have Part D IRMAA brackets, and there's also a bump of about 5.8% along with each of the income bracket categories. Now, the income brackets are the same, but the Part D dollar amounts change based off of those income brackets. Part D is unique in that you may have a monthly premium for your Part D plan if you go the Medicare supplement plan route. Advantage plans typically come with Part D coverage included at no additional cost. But if you are subject to IRMAA, you would still see the IRMAA amount deducted, even if you are on a no-cost Advantage plan. But for the millions who go the supplement plan route with a standalone Part D plan, you would need to pay the monthly premium just to have the Part D coverage, and then if you're a higher income earner in retirement, you would add the IRMAA dollar amounts that you see here on top of whatever premium you were already paying for Part D. So if I have a standalone Part D drug plan that has the average cost of $34.50 a month, and I'm in this IRMAA bracket, my new premium for that year becomes $72 per month. And if you are married filing jointly, each of you are paying that. Next would be the drug plan deductibles. The Part D deductible went from a maximum of $590 in 2025 up to $615 in 2026, an increase of $25 or a bit over 4%. Most, but not all, standalone Part D drug plans have that max deductible of $615. There are a couple of plans with lower deductibles. They tend to be the higher monthly premium cost plans. Now, a big shift for 2026 in drug deductibles is for Advantage plans. We are still waiting on the data to come out, but from what I have felt is that Advantage plan drug deductibles have increased. Now, in 2025, it was $309, and then the projections for 2026, which I know I don't like to work on projections, but the projections are $420-ish as the average deductible amount on Advantage plans. Now, watch this shift. In 2024, 60% of everyone on an Advantage plan with drug coverage had a $0 drug deductible. The full effects of the Inflation Reduction Act took effect for 2025, shifting the cost responsibility to insurance companies. And then only 31% of everyone on an Advantage plan with drug coverage had a $0 deductible there in 2025. If everyone were to stay on their 2025 Advantage plan for 2026, only 14% of the same group would have a $0 drug deductible. There will be people shifting around there, so it isn't a final number for 2026. It just represents what the number would be if people did not switch their plans. So messing with the drug deductibles has been an effect of shifting costs to the insurance companies, which ultimately shifts costs to you. The final section of Medicare Part D would be the maximum out-of-pocket, which went from $2,000 in 2025 up to $2,100 for 2026, a 5% increase. Okay, here are the percentages all laid out on one screen, and the secret code word for this video, if you made it this far, is weighted. Healthcare costs cause worry for many of you, and I get it. I am worried too. I'm not sure where all of this ends up. The rule of 72 tells us that if we are averaging a 9% increase each year, then costs are going to double every 8 years. This is not sustainable for most people. So where do we go from here? Healthcare costs rise almost every year. Original Medicare costs go up. Supplement plan costs go up. Drug costs and the insurance plan to cover those costs go up. The biggest question in Medicare right now is what plans do I get that will cost me less but still cover what I need? And most people choose between a Medicare supplement plan with a standalone Part D drug plan or a Medicare Advantage plan with drug coverage. There are other options, but most choose between these two. This is a video that outlines in detail how much you could expect to pay on a Medicare supplement plan with a standalone drug plan versus a Medicare Advantage plan. And I will see you over there.